From the jungles of Central Africa to bustling global cities, the story of HIV is one of evolution, survival, and resilience. It's a story that has shaped human history and still affects millions today. But what if I told you that this story didn't begin in a lab or a hospital, but in the forests of Cameroon, with a virus that learned to adapt to its new human hosts? This is the ecology of HIV, where science, history, and humanity intersect. Hello, everyone, and welcome. Today, we are exploring the ecology of HIV. We'll discuss where this virus came from, how it spreads, the science behind its impact, and the role we play in controlling it. This isn't just a biological story, it's a human one. By the end of this talk, I hope you'll see how deeply connected we are to the environment that shaped the diseases we face. Let's dive in. To start, let's look at the global picture. As of today, over 38 million people are living with HIV. Each year, 1.5 million new infections are recorded, and around 650,000 people die from AIDS-related illnesses. That's about 1,780 deaths every day. These numbers may feel overwhelming, but they've actually improved significantly since the peak of the epidemic in the 1990s, thanks to advancements in treatment and prevention. What's striking is the uneven impact of HIV across the globe. In high-income countries, where access to antiretroviral therapy or ART is widespread, new infections have been steadily declining. However, in sub-Saharan Africa, which accounts for 2/3 of global cases, and in regions like Eastern Europe, HIV continues to spread. Why the disparity? It's not just about medicine. It's about access to education, cultural attitudes, and the strength of healthcare systems. Let me give you an example. In countries where stigma around HIV is high, people are less likely to get tested or seek treatment. This isn't just a problem of health, it's a problem of society. Imagine knowing there's a treatment that could save your life, but being too afraid of judgment to ask for help. This is the reality for many people living with HIV. Now, let's move to the science. What happens when someone contracts HIV? The virus progresses through 3 stages. First, there's acute infection. During this stage, the virus multiplies rapidly, causing flu-like symptoms such as fever, sore throat, and fatigue. This is when the viral load, the amount of virus in the blood, is at its highest, making transmission more likely. Many people mistake these symptoms for a common illness, so the virus often goes undiagnosed at this stage. The second stage is called clinical latency. This is where the virus becomes less active but continues to damage the immune system quietly. Without treatment, this stage can last several years, but eventually, the virus progresses to AIDS. This final stage is characterized by severe immune system damage, leaving the body vulnerable to opportunistic infections like tuberculosis, pneumonia, and Kaposi's sarcoma, a type of cancer that was once rare but became a hallmark of the AIDS epidemic. Here's an interesting fact. Kaposi's sarcoma was one of the first indicators that something unusual was happening in the 1980s. Doctors in New York and San Francisco started seeing young, otherwise healthy men developing this rare cancer, which eventually led to the discovery of HIV or AIDS. Fortunately, treatments like ART have transformed HIV from a fatal disease into a manageable chronic condition. ART works by suppressing the viral load to undetectable levels, which not only helps individuals live longer but also prevents them from transmitting the virus to others. This is known as U equals U, undetectable equals untransmittable. It's a powerful concept that has helped reduce stigma and encourage people to seek treatment. Let's talk about how HIV spreads. The primary modes of transmission are sexual contact, blood-to-blood contact, and vertical transmission from mother to child during childbirth or breastfeeding. But here's something fascinating. Not everyone exposed to HIV becomes infected. Some individuals have a mutation in the CCR5 gene, which makes them resistant to certain strains of the virus. This mutation, known as CCR5 delta 32, is most commonly found in people of Northern European descent. It's an exciting area of research and has already played a role in one of the most groundbreaking cases in HIV history, which we'll discuss later. To truly understand HIV, we have to look at the disease triangle: the agent, the host, and the environment. The agent is HIV itself, a retrovirus that specifically targets CD4+ T cells, which are crucial for immune system function. The host is the human body, with its unique vulnerabilities shaped by genetics, health status, and behavior. Finally, the environment includes factors like access to healthcare, education, cultural norms, and even geography. Together, these three components determine how a disease spreads and who it affects most. Let's explore HIV's origins. HIV-1, the strain responsible for the global pandemic, is believed to have spilled over from chimpanzees to humans in southeastern Cameroon around 1908. This likely happened during bushmeat hunting, where hunters came into contact with the blood of infected animals. Once in humans, the virus mutated and adapted, eventually becoming transmissible between people. It spread along the Congo River to urban centers like Kinshasa, where increased migration, unsterilized medical practices, and changing social dynamics accelerated its transmission. Did you know that HIV remained under the radar for decades before it was identified in the 1980s? Researchers later traced its spread through blood samples collected in the mid-20th century. This delay in recognition highlights how diseases can circulate silently before reaching epidemic levels. HIV didn't just change medicine, it changed society. In the 1980s, the epidemic galvanized the LGBTQ+ rights movement, as activists fought for better healthcare and an end to discrimination. It also led to the creation of global health initiatives like PEPFAR and the Global Fund, which have saved millions of lives. But the epidemic also exposed deep inequalities. While high-income countries have made significant progress, many low-income regions still struggle to provide basic care. This disparity underscores the critical need for equitable healthcare systems. One of the most fascinating stories in HIV research is that of the Berlin patient, Timothy Ray Brown. In 2008, he became the first person cured of HIV after receiving a stem cell transplant for leukemia. His donor had the CCR5 delta 32 mutation, which made the transplanted cells resistant to the virus. This groundbreaking case proved that a cure is possible, though the procedure is too risky and expensive for widespread use. However, it opened the door to new approaches, such as gene editing, which could one day make HIV resistance a reality for more people. Looking to the future, the fight against HIV faces both challenges and opportunities. Climate change and urbanization could alter the distribution of infectious diseases, potentially increasing the risk of HIV in certain areas. On the other hand, advancements in vaccine research, particularly using mRNA technology, offer hope for prevention. Global health policies, such as UNAIDS 95-95 targets, aim to eliminate HIV by ensuring that 95% of people know their status, 95% of those diagnosed are on treatment, and 95% of those treated achieve viral suppression. So, what can we learn from the ecology of HIV? First, that diseases are deeply intertwined with human behavior, culture, and the environment. Second, that science and innovation have the power to transform lives. And third, that we all have a role to play in fighting stigma and supporting those affected. HIV's story is far from over. It's a tale of resilience, scientific breakthroughs, and societal change. Together, we can shape the next chapter of this story, one that moves us closer to a world without HIV. Thank you for listening.